This is part 2 of the film on introducing spring tests and in treating small joints such as the joints of the upper cervical spine, or treating joints in the foot and ankle. It's helpful to have an appreciation of how much force to apply to take up the slack, and then how much force to evaluate the forward thrust and recoil, which is the spring test portion of a joint mobility evaluation. So arbitrarily, using the example of the cuboid, if I stabilize structures all around it, including calcaneus, and I'm primarily testing movement on the calcaneus, then I can clasp and stabilize the other structures, and then I can pinch it and I can evaluate superior and inferior glide, and I can also add a rotational element. So what is the amount of force that I'm going to use there? I can come to the upper cervical spine and I can block along the articular column below C1, and I can take a finger and then I can impart a gentle force to take up the slack, impart a spring test, feel the recoil, or in treating, take up the slack and do very gentle oscillations. So let me answer that question for you. The amount of force is very small, and you can take an orange and with your finger you can push into it and indent it, and there should be a distinct stop, and then you should be able to impart a spring and feel a recoil from the structure. You can do the same thing with the thumb. Take up the slack. There's a distinct endpoint. You should be able to spring it, feel some recoil. And you can also measure those forces with a thumb gauge. So most PT clinics have one of these, and so you set it at 0. And I'm first going to practice springing with my thumb. Okay, so my finger is going to be the stabilizing force, and I pinch it with my thumb and I go to 5 pounds. And that would be taking up the slack on an average small joint in the human body. And then I would do a spring mobility test going to 8 pounds and letting it come back to 5. I hope that you can see the small thin black arm that moves. Okay, so when we take up the slack at 5, you see the red arm, and then when I go to 8 pounds and come back, of course the red arm is going to stay at the higher number, but you should be able to see that black needle travel from 5 to 8 and return, 5 to 8 and return. Very good. And so now the thumb is going to be the stabilizing part, and I'm going to lift up with my finger, very similar to lifting up when I'm mobilizing C1. Okay, so using the thumb gauge, again we reset it at 0, and the thumb is stabilizing, so it is the index finger that's coming up. So we come up to 5 pounds, and then we go 5 to 8 and recoil to 5, repeat it, recoil to 5, repeat and recoil to 5. When you're done with the spring testing and you're confident with your information, and that can be in one test or it might be in 2 or 3 repetitions, when you're ready to let go, there's a final recoil. The tissue gives a final let go of that part which takes up the slack. So I hope that's very straightforward. If you don't have a pinch gauge, you can use a bathroom scale, but I have to qualify that it has to be one that is spring driven. I really like this one. The brand is Pelouze, and it's a heavy duty one, and this one goes up to 100 pounds. And you can buy them online fairly inexpensively, but you can also find a $5 or $10 scale at any big box retail place. Just make sure it's not the digital one, because you want to I can't really articulate why the spring is much better. Just trust me on that. So pushing with my thumb, I go to 5 pounds, and I don't know if, I hope I'm not covering that up. We go to 5, and you can see real time. It's a much better visual with the spring type. And then we go to 8, and we come back to 5. Go to 8, and come back to 5. The digital can be confusing because it'll show you the highest number. And that's why we want a spring scale versus a digital scale. So sorry I tripped up there for a little bit. But using my thumb, I take up the slack and I go to 5 pounds. I always want to keep that slack taken up when I'm testing. So now I want to actually see, does the joint move? And I go to approximately 8 pounds and come back. Yes, it recoils also. It moves and it recoils, it moves and it recoils. And then I come back to 0. So now when I'm ready to treat a joint, I found a joint with a restriction in which I take up the slack, and then I try and spring it, and there's no give with a reasonable amount of force. So that joint is stuck somewhere in the range. Alternately, you may have a joint in which you apply an appropriate amount of force and you cannot even take up the slack. So in both of those scenarios, you want to treat that joint and see if you can gain mobility. There are certainly examples where it's not going to happen when the joint is ankylosed, but we're focusing on treatable joint restrictions. So in that example, in the example where you can't even take up the slack, you're simply going to push into it with at least 5 pounds of force. Even though it's not moving, you're creating a force, and you maintain that for about 2 minutes to get it to release. In an example where you can take up the slack, you go to 5 pounds, and you maintain the force there, and you're going for 2 minutes. And in other examples, you can use oscillations as well. Okay? So I hope this has been meaningful to you in demonstrating a gentle amount of force, useful at small joints, and as we practice on the day of the class, and as you practice with your clients between now and then and thereafter, this will become second nature to you. And I think the important point that I want to emphasize is less is more. Using smaller forces is going to be helpful to the client, help them relax, not feel intimidated, and it's helpful for you in the process of gathering the information. So less is more, and if you can practice with your index finger and your thumb in generating 0 to 5 pounds, and then 5 to 8, return to 5, 5 to 8, return to 5, that represents how a normal joint would behave. But it also gives you a sense of the amount of force to use, not just in spring testing, but the amount of force to use in treatment. And there are inter-individual differences. Someone has bigger anatomy, someone has denser connective tissue, more muscle, whatever. It's going to be a small variance from that. This is a very good average for you to have a basic skill set, and I tend to blab on, so I'm just going to cut it right here. I hope this video is helpful to you. Thank you for putting up with me.